From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to our listeners from around the world. We're really pleased that you can join us for this JAMA author interview. I'm Dr. Tracy Lieu, Deputy Editor at JAMA, a pediatrician and researcher with Kaiser Permanente. Today, I'm very pleased to welcome Drs. Bill Heerman and Eliana Perrin, authors of an exciting new randomized clinical trial in JAMA titled A Digital Health Behavior Intervention to Prevent Childhood Obesity, the Greenlight Plus randomized clinical trial. Dr. Heerman is the William K. Warren Foundation and Chair in Medicine and Director of the Division of Academic Pediatrics at Vanderbilt. Dr. Perrin is the Bloomberg Distinguished Professor of Primary Care in the Department of Pediatrics and the Schools of Medicine and Nursing at Johns Hopkins. Welcome. I hope it's okay for us to proceed on a first-name basis.
Yeah, thanks for having us, of course.
Yeah, thank you so much.
Eliana, preventing obesity in early childhood has been a very challenging issue for pediatricians and other clinicians, and your trial builds on an earlier study of health behavior counseling that found some success. Can you tell us about that earlier study and then why you initiated the current trial?
Yeah, well, like you said, childhood obesity is a big problem. 30% of preschoolers already have overweight or obesity, and research shows that even young children with obesity don't outgrow it. But more importantly, new parents want guidance on how to keep their children healthy. One parent of a 4-year-old once told me, "No doctor ever told me not to give him juice. Now he's hooked, but it would have been easier not to start in the first place." So well over a decade ago, Russell Rothman, Lee Sanders, Shauna Yin, and I thought it was time for a paradigm shift. We needed to start thinking about primary obesity prevention with babies. So we developed and tested what we called the Greenlight intervention and used materials in primary care well child checks to help parents with healthy eating, physical activity, screen time, and the like. In our first big study, we found that Greenlight helped children have healthier weight in the first year of life, but unfortunately, we did not prevent obesity at age 2 as we'd hoped. So with this study, we added a digital health component to see if counseling is more effective at preventing obesity when we're texting goals and giving guidance more frequently and outside of the pediatrics office, including for that second year of life when pediatric visits are less common.
It's very interesting digital intervention. Tell us more about how you selected and developed the components of it.
Yeah, so first I want to give a huge shout out to Shauna Yin and Melissa Kay, co-authors on this publication, who really led this effort with me and others. But we know that texting reaches the vast majority of new parents. And so we actually engaged parent partners to create these text goals for healthy habits in early childhood. And we tried to make the text really personalized. We used the child's and the parent's name. They were in Spanish or English based on the parent preference. And they all used health literacy principles so that parents of all backgrounds could understand and benefit. Then we created check-in messages like, how many sweet drinks did Lieu have yesterday? And then finally, we created responses that were encouraging or cheerleading. And we gave parents tips to sustain or improve the behavior because we know this is hard and parents need help. All of our texting is automated, but it hopefully feels personal. The system was adapted from foundational work that Gary Bennett led at the Duke Digital Health Center. And our team of obesity prevention, health literacy, nutrition, health technology researchers, but also those parent partners and research coordinators wrote hundreds of messages for the study. And ultimately, over 200,000 messages were sent to families.
That's very impressive. It sounds as though this was a very parent-centered intervention, really along the lines of your funding source, the Patient-Centered Outcomes Research Institute.
Yeah, definitely.
Bill, can you tell us about the study's design and setting and the population that you included?
So the Greenlight Plus trial was a randomized trial, and it was conducted really coast to coast. We enrolled families with new babies right after birth from several medical centers and 13 clinics around the country, including sites in Miami and New York, Stanford, North Carolina, and Tennessee. And families were randomly assigned to either the digital intervention that Eliana just mentioned or the standard Greenlight intervention alone. And the standard Greenlight intervention helps pediatric primary care clinicians to deliver age and developmentally appropriate advice to parents about health behaviors. Things like breastfeeding, avoiding screen time, helping parents know how and when their baby is hungry, and how to avoid overfeeding. And a couple of things are really important about this Greenlight intervention. It focuses on using low health literacy communication techniques, and it trains providers to deliver this advice during the established well-child checks that every child in the United States already receives. Now, our main hypotheses were that by adding this digital aspect of the intervention to the standard Greenlight intervention, we would see improvements in healthy growth trajectory over the first 2 years of a child's life and improvements in the rate of childhood obesity at age 2.
Tell us a little about your key findings.
Well, the bottom line is that this intervention worked. It actually improved healthier growth trajectories over 2 years of life, and it reduced childhood obesity. For children that were in the Greenlight only group, about 13% of them had obesity at 2 years old. That was compared to the digital intervention plus the Greenlight group, where only 7% of children had obesity at 2 years. That's a relative risk reduction of about 50%. And that means that for every 19 infants who got the intervention, we prevented 1 case of early childhood obesity. Now, we should probably pause here and say this is a big deal for 3 reasons. First, we think we're among just a couple of studies to prevent early childhood obesity, and we're certainly the largest and the only multi-site study that we've ever seen. Second, this was a very diverse population. Obesity prevention has been largely unsuccessful in previous studies, especially among populations who are at the highest risk. And the third thing to note is that the effect size for this study was quite large for these types of studies. This digital intervention really helped a lot of people who needed it. There are probably 2 other things that are worth mentioning. The first is we sent a lot of text messages. People were slated to receive at least 7 text messages every 2 weeks for 2 years. And at the outset, we weren't really sure how people would respond to that many messages. Turns out, most people stuck with it for the 2 years. In fact, among the 449 parents who received the text messages, more than half of them responded to more than half of the text messages. But there is one more thing that I should probably note. One of the most exciting things to us is that there was some evidence that this intervention worked among the populations who had the highest risk of childhood obesity. We looked specifically at how well the intervention worked among certain populations with the highest risk of obesity and found that the intervention was especially effective among households with food insecurity, among children who identified as non-Hispanic Black or Hispanic, and those whose parents had low health literacy. So, to us, that signals that the intervention may have the potential to reduce health disparities in childhood obesity.
Bill, I find it very impressive that so many of the parents responded to so many of the messages over, the first 24 months of life. That's real sustainability. What kinds of responses were the text messages calling for?
So 5 times over every 2 weeks, we would send a text message that asked someone how they were doing with a goal that had been set at the beginning of that 2-week block. And so at each of those time points, we would ask parents, how are you doing with your goal to exclusively breastfeed? And then they would respond to us with a often numerical number from 1 to 5, or with a Y or an N to say if they had met that goal. And then once we got that message back, they would receive an automatic response that was tailored to their message. So if they said, I had a really hard time with that goal, we would text back, that's okay, keep up the good work. And then we would suggest a tip of how they might continue with that health behavior. Or if they said, yeah, I'm doing great, we would say, great job, keep up the good work. And then we'd still give them some advice after that.
Yeah, terrific. How interesting. Yeah, Eliana, the health behavior counseling intervention, so the baseline intervention, requires some training and materials and time. And then for the digital intervention, you have the text message system and the website on top of that. What are some of the factors that might affect whether or how the health behavior counseling and then the new digital intervention could be implemented in other settings?
Yeah, no, that's a great question. And in truth, we don't know. We're hoping to learn that in future studies. We know that this study took place within academic health centers, including teaching and non-teaching clinics. We know that we had a certain population in our study compared to the general population. We had more parents who identified as Hispanic or Latine. There were about 45% in our study who did so compared to about 20% nationally, and a few more non-Hispanic Black parents than nationally, about 16% in our study versus 14%. We also know that many of our parent-infant dyads came from low-income households and from historically marginalized groups who are thought to be at greater risk for obesity. In the future, we'd love to figure out if this could work for practices that are not part of academic medical centers. And to make it scalable, we also need to figure out just the very question that you asked of what makes a parent more responsive. And part of that is figuring out what parts of the intervention parents really liked and which parts were more burdensome. And then finally, I think in order to implement it further and reach the vast majority of parents in the United States, we really need a way to scale up the technology. Again, there are millions of children who are at risk for obesity in the United States, so we know this is really important. And so your question about who responds and how, we don't know that yet, but we're hoping to find out.
Yeah, very interesting. I'm also thinking of some of the business model and financial and policy aspects of, how you get a new intervention like this that uses technology adopted in just diverse healthcare systems and settings.
Yeah, I think there's a lot we can learn for sure.
Bill, to wrap up, what are the take-home messages for clinicians? What should the average pediatrician or other clinician who takes care of young children take home from this?
Well, I think the first thing is that new parents want to hear from pediatricians. And text messages can be really effective ways to communicate with families. But I think the place that we might want to end today is just by saying that this study showed that obesity prevention can work. So we shouldn't give up on it. The best thing a pediatrician can do right now is to provide advice around healthy behaviors starting early in the child's life. This is incredibly important because if we can prevent childhood obesity, we can set children on a lifelong trajectory of health and avoid making many of the long-term complications that obesity causes.
Bill and Eliana, thank you for a wonderful overview of a very interesting study.
Thank you so much for the opportunity.
Yeah, thank you.
I'm Dr. Tracy Lieu, and I've been speaking with Dr. Bill Heerman and Dr. Eliana Perrin about a digital health behavior intervention to prevent childhood obesity. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.